Here we're actually working without any incisions, so we're basically going through the mouth or through the back end, and then all of the operation is done through instruments inserted through the channel of the scope. We are inserting a high-definition video endoscope through the mouth and down what's called the esophagus, the swallowing tube. And if there were a tumor in this area, then we could obviously visualize it well, and then we can insert instruments through the scope that will come out into our visual, sort of where we're visualizing, and then we can operate with these instruments by manipulating the scope to cut around a tumor and underneath it and remove it in one piece. So from a patient, there's a lot of advantages. I think the main one is that it's much more straightforward in terms of undergoing the procedure. So it's using, what we call a natural orifice, so the mouth or the back end. So there's no skin incision. There's very little or no pain after the procedure. The recovery is very fast. Often patients can go home the same day or 1 or 2 days in hospital only. So that's much faster than, say, if you had to have a more formal operation with recovery from an incision, other potential complications like infections afterwards. And then in terms of returning back to activities or work, within that same week, you're essentially back to normal. So I think it's, from a quality of life standpoint and from a safety standpoint, there's a lot of advantages for patients. And it's equally effective as a traditional cancer surgery.
It's meant a whole lot of anxiety out of my life because I had two losing options basically, either very high risk surgery or living with the cancer. So this turned out to be non-invasive and took away the anxiety, and I just feel extremely lucky that we caught my tumours early enough and they were growing slowly enough that I was a candidate for this. We've done 2 rounds of this procedure so far. The first was here at the PLC and was under general anaesthetic, and they kept me in overnight for observation. The second was done under sedation at the foothills, so I went in at 7 o'clock in the morning, was home by lunchtime, could eat soft foods, and the following afternoon I was out playing snooker with my buddy.